Whiplash and neck pain. Whiplash is a common injury caused by a sudden jerking movement of the head forwards and backwards or side to side. The force causes the soft tissues around the spine to be stretched and pulled alongside the joints, which often results in pain and stiffness. What causes whiplash? The most common causes of whiplash are road traffic accidents, blows to the head, e.g. during contact sports, or slips and falls, which may result in a sudden jerking movement of the head and neck. Symptoms of whiplash. Whiplash can result in pain and stiffness around the neck. The muscles may feel tender to touch. You may have a loss of range of movement in the neck. You may have pain when moving the shoulders and arms. You may experience headaches. Your sleep may be disturbed, and it is not as common, but some people experience pins and needles or numbness in the arms. Symptoms of whiplash can sometimes take 24 hours to develop and can worsen over a couple of days. Whiplash is usually diagnosed through the description of symptoms and the mechanism of injury. Further investigations such as X-rays and MRI scans are not usually carried out unless more serious spinal injury is suspected. Whiplash recovery. The time it takes to recover from a whiplash injury can vary greatly. Most people will feel better within a couple of weeks or months, but in some cases it can last up to a year. It is important to try and maintain movement of the neck following a whiplash injury to prevent increased stiffness and pain. Avoid resting your neck for long periods of time, as early movement will improve and speed up recovery. Pain and stiffness on movement is normal and will not cause damage. The following exercises may help to improve your movement and pain. Either sitting or standing tall, try and look down, taking your chin towards your chest. You should feel a stretch around the back of the neck and across the shoulders. Try taking your chin up to the ceiling in the opposite direction. Try looking over your shoulder, looking left and looking right. And try tilting your head, so taking your right ear down towards your right shoulder and then your left ear down towards your left shoulder. With exercise and these stretches, it is important to gradually increase the amount of time you hold each exercise for and how many repetitions you do. Ideally, you could hold this stretch up to 30 seconds and repeat 3 times. We're looking for a gentle stretch and some pressure. We're not looking for pain with these exercises. As time goes on and the more you practice these exercises, try increasing the amount of movement you have by looking further down or looking further over your shoulder. Medication can be used as part of the management of your symptoms. Please seek the advice of a pharmacist or GP with regard to the use of simple pain relief or anti-inflammatories. Using medication can help to reduce the pain and allow you to return to your activities and speed up your recovery. These medications should be used regularly instead of just when the pain is at its worst, but it is important to follow the advice of your GP or pharmacist taking the medication as prescribed. Heat and ice is also recommended in the management of your symptoms. The use of heat can help with pain and muscle relaxation. Use a warm water bottle or a microwavable wheat bag, following the instructions provided when you purchased it. To protect your skin from heat burns, wrap the item in a few layers of towel. Leave it in place for 15 to 20 minutes, and this can be reapplied after 2 hours if you wish. The use of ice can help with pain and inflammation. Use crushed ice cubes or a bag of frozen peas. To reduce the risk of developing an ice burn, place the ice pack in a wet towel. Leave in place for 15 to 20 minutes. It can be reapplied after 2 hours if you wish. It's normal for the skin to become pink with either heat or ice. However, you should not experience discomfort or a burning sensation, and if you do, remove the item immediately. Don't apply heat or ice packs if you have poor sensation or poor circulation, if you are diabetic, or there are over areas of infection. Physiotherapy. If your whiplash symptoms should persist, your GP may refer you to be assessed by a physiotherapist. Physiotherapists can help restore movement and function when you have been affected by injury, illness, mechanical, physical, or developmental complaints. Physios help to reduce pain, stiffness, or physical discomfort to help restore optimal function. When you come for your physiotherapy assessment, we will assess and advise you on the condition and together with you plan the most appropriate treatment which fits the needs and goals for your lifestyle and activities. With regard to whiplash, physiotherapy aims to improve your movement and function, getting you back to work and back to your functional hobbies, rather than trying to rid you of the pain. As acknowledged previously, this can last for a few weeks, months, or even up to a year. Long-term or persistent whiplash. If your symptoms persist over 6 months, whiplash injury is classed as long-term or chronic or persistent. Continued physiotherapeutic exercise and the use of adequate pain relief is advised. If you find you are struggling to cope with your symptoms, speak to your GP regarding other support that is available. Please use the following links, or the links via the website, for other websites, leaflets and information with regard to whiplash. On here you will also find our physio-led exercise guidance on the stretches we mentioned previously. Thank you very much.